The decision for hospital admission or hospital observation is not always an easy one. It's based on your doctor's judgment and your need for medically necessary hospital care. So in this video, I'm going to share with you the difference between being in the hospital as an inpatient and being in the hospital under observation. They are completely different and also treated differently, and how Medicare pays for your care based on your situation. Now, if you are wondering if you should pay attention to this topic, I will answer that for you. Absolutely. Many Medicare beneficiaries have been blindsided by unexpected out-of-pocket costs due to their hospital situation. Now, how do I know this? Well, when I do a video for you, I do a lot of research, and that's because many of my videos come to life due to conversations, suggestions, questions from you. So it's a tremendous amount of responsibility to make sure I provide accurate information for you. And I'm always happy to take on that challenge. So let's get started with this video. So the first thing we're going to do is start with the definition for what it means to be a hospital inpatient. According to Medicare, inpatient admission is generally appropriate when you're expected to need 2 or more midnights, not just nights, but midnights of medically necessary hospital care. But your doctor must order such admission, and the hospital must formally admit you in order for you to become an inpatient. And by contrast, if you are in the hospital under observation, then you are classified as an outpatient. When you're under observation, you are in the hospital but haven't formally been admitted with a doctor's order. Instead, the doctor is keeping you under observation to monitor your progress. For example, let's say you visit the emergency room and then you are moved to ICU. You stay in ICU overnight where you are being closely monitored, your progress is being watched, and then the next day you are released to go home. What do you think? Were you admitted as an inpatient or were you under observation? Well, if you listen closely, you're being closely monitored, so that kind of indicates right there that you were under observation. So if you chose under observation, you are correct. So even if you are in the hospital and you spend one night in a regular hospital room and a regular hospital bed, that doesn't necessarily mean that you are a hospital inpatient. You could be under observation. And the same is true if you spend several nights in the hospital, in a regular hospital room, in a regular hospital bed. It could mean you are still under observation, even if it's several nights. So here's where it gets a bit sticky. If you are moved to a skilled nursing facility for rehabilitation care after your hospital stay, you need a certain number of inpatient days to qualify for skilled nursing facility care. So a qualified stay is key here. And what's a qualified stay? It's when you have stayed in the hospital as an inpatient for 3 days. Remember, if you are in the hospital under observation, you are considered an outpatient, and that does not qualify as inpatient hospital status. According to Medicare, an inpatient stay begins on the day you are formally admitted to a hospital with a doctor's order. That's your first inpatient day, and the day of discharge doesn't count as an inpatient day. So if the hospital recommends rehabilitation care at a skilled nursing facility, but you didn't have a qualified hospital stay, guess who's responsible for the bill at the skilled nursing facility? Well, it's not Medicare. It's not even your MEDICAP, Medicare supplement insurance, because remember, MEDICAP, Medicare supplement coverage only pays for what Medicare approves. Medicare does not approve your stay at a skilled nursing facility if you did not have a qualified hospital stay. Now, I don't want to sound like a negative Nancy here, but please don't take this information lightly and assume that this will never happen to you. I came across plenty of stories of individuals who were surprised by out-of-pocket expenses once they left a skilled nursing facility because they didn't know they were under observation at the hospital. And one of the most popular cases is Mr. Verdini, who was in a car accident, fractured his neck, and was in the hospital for 5 days, and then moved to a skilled nursing facility for rehabilitation. Once he left that facility and went home, he received a bill a rather large bill. He did not expect to receive it. He thought he would be covered under Medicare. He didn't know he was under observation the entire time he was at the hospital. To him, it felt like regular hospital care, as if he was an inpatient. But let you listen into Mr. Verdini's own words about how he felt about his stay.
The trouble is, I wasn't aware that Medicare was not going to be paying for my stay at the rehab, which was a little over $400 daily fee.
In the end, he was stuck with a bill for $7,700 for the weeks he spent in a rehabilitation center after a car accident left him with a neck fracture.
By all accounts, did it feel like you had been admitted to the hospital?
Absolutely. Absolutely. You know, I couldn't tell the difference. And I don't know that anybody else who ever experienced it could tell the difference.
But there was a huge difference. He later discovered that he was under observation and not admitted, and as a result, Medicare did not cover post-hospital care.
So what's being done to protect you from not having the same thing happen that happened to Mr. Verdini and many other Medicare recipients? Well, there's not a whole lot, but if you do go into the hospital, right now, hospitals and critical access hospitals are required to provide you a notice. It's called the Medicare Outpatient Observation Notice, also known as MOON. They must give you this form if you have been in the hospital under observation for a certain amount of time. And this notice, of course, is provided to you so that you know where you stand when you're at the hospital. This is a great notice to have, and I was reading through it, and at the bottom of the notice, it is recommended that you call Medicare if you have any questions, which is great, except when you are in the hospital, you may not feel like getting on the phone with Medicare or anyone else for that matter, which brings me to my bonus tip. If you haven't set up an authorized representative, someone to talk to Medicare on your behalf, you may want to go ahead and do so now. And if you already have a representative, please consider adding a secondary person to speak to Medicare for you. That first person, that first representative that you signed up may be a primary caregiver. So someone who is at the hospital taking care of you, handling other affairs, maybe just preoccupied and not in the right frame of mind to speak to Medicare for you. So if you have a secondary person that can step in and handle that responsibility, it may be a good idea to put someone in place. But please make sure that you reach out to them and ask for their permission and make sure that they are on board with it before you sign them up. And to sign them up, I have a video on how to do it, simple steps on getting an authorized representative in place. There's a link somewhere around here for that video, and of course I always put a link in the post or description below. And I'll close with some promising news. In March of 2017, a bill was introduced to amend the Title 18 Social Security Act to deem an individual receiving outpatient observation services in a hospital to be an inpatient for purposes of satisfying the 3-day inpatient hospital stay requirement with respect to Medicare coverage of skilled nursing facility services. So basically, the bill wants to include those outpatient services at the hospital when you are under observation towards a qualified hospital stay, which would be helpful if you are moved to a skilled nursing facility for rehabilitation care. And hopefully there will be some action on this bill and I can give you a report in the near future. And speaking of future, if you want to subscribe for more video topics, please feel free to do so. If you're already subscribed, thank you. And you can click on the little bell icon to receive instant notification when a video is uploaded. Thank you for being here, and if you like this video, please click the like button. Don't forget to share it, and please comment on your thoughts about this topic. My name is Joanne Quinn. I'm an independent insurance agent. Thanks for being here today. I'll see you next time. Bye-bye. Responsible for rehabilitation. Bless you. No. So it's really important. I typically try to do happen to Mr. Verdini from the same thing. Is it still recording?